You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Good morning, everyone, and welcome to the Health Hub. I'm Kathy Biasi, your host, and along with our producer, Alex Diaz, we would like to welcome you to our show this Tuesday morning. Good morning, Alex.
Good morning, Kathy.
How are you doing?
I'm feeling good, thank you.
Feeling good. Yeah. We into our last show of November. It's hard to believe.
I know it's been a journey this year.
It has. It's been a good year.
We've got some great shows coming up in December, of course, but it's an exciting time.
It is. Busy time. Very busy time. In fact, we were out this weekend and got a chunk of our Christmas shopping done, so that makes me feel better. But no matter how prepared, it still seems to be rushed.
There's always something that sneaks up.
Well, we still have to decorate the house, which each year becomes more and more of a chore for me. I'm trying to minimize with a few punch pieces.
Typically, we decorate our house on December 1st. That's when we start to open up everything and get everything out of the boxes.
That's this weekend.
Yeah.
That's this weekend. Yeah. It's usually... Yeah, we don't get our tree this year. We're getting it on the 7th. We try and do it as a family, and each year with the kids getting busier and busier, it's hard to nail down a date to do these things.
That's a nice tradition.
It is a nice tradition, but we push it. So actually, we're getting it on the 8th, and our family, the kids, and they're well into their. Well, my youngest one is 20, so we've got a 20, 25, 27, 20. Every year they get a Santa picture done for me. So the middle years, it was like pulling teeth, and now it's just become a thing. So these 4 adults, and then my daughter-in-law is involved now, line up with all the children and sit on Santa's lap and get their picture done. So that's another difficult one. It is fun. And that's usually our Christmas card that goes out. So it's kind of a tradition, and hopefully it carries on, because I would love to see, as the kids get older and they start having their own kids, that they're involved, with the picture too. It's kind of fun. But again, really hard to nail down with the kids' busy schedule, but we'll get it done. Today's show is live. Our number is 416-245-1534. We're going to really work hard on trying to get people calling in next year. I think it would add such a great piece to the show. So it would. We're really going to try to promote this a whole bunch more. But guests like to interact, and they're such experts that, sometimes, the questions that come to my mind may not be all the questions that come to your mind. So we're going to work on that in 2020. But do follow us. We are on Instagram, Twitter, and Facebook at the Health Hub RMC. And I'm going to cough. Excuse me. Or you can email us at thh@radiomaria.ca. Alex, do you want to talk for a sec while I have a sip here? Throwing you in the spot.
No problem. So, in fact, listeners, just to let you know, during the Advent season that's coming up, we will be having some programs for specifically Advent and Christmas. So we do invite you to visit our website over the next week or so, and we will definitely have that schedule of programming made available.
Am I back on here?
Yes, you are.
Sorry about that. I got something caught in my throat. Anyways, follow us on Instagram, Twitter, and Facebook. We are at the Health Hub RMC, or email us at thh@radiomaria.ca. If you have any questions, we are well into February for lining up guests for the show, but have the rest of the year open. So any ideas, please bring them forth. We love to hear your comments and any questions you might have. Also, as you know, all of our podcasts all of our shows are turned into podcasts. We are the Health Hub on iTunes, SoundCloud, all your favorite podcast platforms. And you can also find our podcast on the Radio Maria Canada website, which is radiomaria.ca, and on my website, which is kathybiasi.com. Okay, I think I'm through this now. Hopefully we're there. Okay, so this is a busy part of the year, of course, but life in general is rushed. And sometimes I think we feel that we fall short in many areas when it comes to cultivating solid nutritional foundation and, to a larger extent, family bonding. So when I read this study, I thought, you know what, I'm going to pass this along to you all as a real pat on the back to even small steps make a big world of difference. And this is a study that was done by research Matea Dalaker, Jutta Mata, and Ralph Hertwig from the Max Planck Institute for Human Development and the University of Mannheim. And both of these places are located in Germany. And they recently co-wrote a meta-analysis on the components of healthy family meals. And what they found should give heart to all you busy families who are really, really trying hard to make it work. And here we go. What they found were 3 key points were that there is no real magic number regarding how often family meals must take place to be beneficial. We're talking about family meals. We're talking about sitting around the table and sharing a meal together. They found that even 1 meal per week can have beneficial effects. They are likely smaller effects if it's only 1 meal a week, but even the small effects can add up and become very, very positive over time.
Yeah, in fact, every interaction, every moment you have together is impactful.
It is impactful, and I think we get down on ourselves because I know that we're all busy, in all stages of our lives, but especially if you're a parent of younger ones that you are taking to, events, whether it's dance, hockey, whatever you're doing, extra schooling, by the time you get them home, and if you're a working person, you can really feel overwhelmed. And I think, you can get a real sense of not being all that, and that's a stressful thing. So know that, even if you're sitting together, and it doesn't have to be a complicated meal.
Right.
So, if what works for you is having a real simple pizza that you order in, and that's going to work for you to sit down together as a family, take that one day. Take that as your cheat day of the week, but sit together and eat. And to that end, They also found that if you're eating together and you're trying to cultivate this family bonding,
right,
turning off the TV is essential. And we've talked about having the TV on and having it does impact negatively on the digestion. But when you're sitting around and you've found that even if it's a half hour to grab a slice of pizza together and you're sitting around a table, if you've got the distraction of a TV on, you're not fully engaged. So take the time, shut the TV off, and become engaged. And this day and age where conversation is a real skill as opposed to just something general that everyone seems to, we seem to have lost this
ability to talk to each other.
To talk, and I'm thinking experiencing that at the moment. We seem to have lost this ability to communicate. Shutting the TV off really forces us to find that engagement. So that's also very key. Yes. A key piece of research that they found. And the other key piece was that getting children involved with the preparation of the food or even just setting the table is also impactful. So, the actionable steps speak for themselves. Pick a day. The meals don't have to be, complicated on that day that you're going to sit together and shutting the TV off. But, you're doing a good job. When you're trying your best and you're to me, if you're feeling guilty that you're not doing
that
enough,
only means you care.
Exactly.
That's right.
And I think it does. I think when you've got that feeling that, man, I could be doing better, you're probably doing a pretty good job.
Yeah, it's always a better thing to be questioning your motivations and your purpose, so that you can continue to grow.
Yes, grow and build on that. So, a sort of a feel-good for a Tuesday morning, and especially running to this busy time. Take heed, give yourself a pat on the back. You're doing a good job. You're doing a good job. So on to today's show. This is something that has got a lot of interest for us, and I guess it's not something that I have come across in practice, to be perfectly honest, but chronic fatigue is an issue for many, many people out there. And our guest is Dr. Nisha Chellam, and she is the best-selling author of Transform Your Thyroid, The 5 Steps to Regain Your Thyroid and Get Back Your Life. She was diagnosed with Hashimoto's, but prior to this had a failing tug-of-war with weight gain, seasonal allergies, joint pains, migraine headaches with normal blood tests. She was diagnosed with prediabetes and vitamin deficiencies when she got exposed to the clinical application of functional medicine. Applying these principles, she was able to completely resolve all of her medical issues. Since then, her only goal has been to spread the message that there is a different way to diagnose and resolve health issues. She believes chronic symptoms are a default to not seeking a better way. Our learning points today: what is the clinical definition of chronic fatigue? What is the functional medicine model for dealing with chronic fatigue? And how can we take the steps right now to combat fatigue? So we'll be talking about this and lots of other interesting things when we return from our break.
Grace was a kingdom. I stopped at the gate, thinking I don't deserve to pass through after all the mistakes that I've made. Oh, but I heard a whisper as heaven bent down. Said, child, don't you know that the first will be last and the last get a crown? And now I'm just a beggar in the presence of a king. I wish I could bring so much more, but if it's true, you use broken things, then here I am, Lord, I'm all yours. Tell me it's true, that it's never the perfect, it's always the ones with the scars that you use. Oh, it's the rebels and the prodigals, it's the humble and the weak, all the misfit heroes you chose. Tell me there's hope for sinners like me. And now with gates open wide, and there's a seat at the table just waiting for you, so come on inside.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back, everybody. Today's show is live. Please feel free to call us if you have any questions for Dr. Chellum. Our number is 416-245-1534. And please do follow us. We are on Instagram, Twitter, and Facebook. We are at the Health Hub RMC. Dr. Chellum, welcome to the show.
Thank you so much. Thank you for the invitation, and I'm excited.
Yeah, it's a pleasure to have you. We're glad that you take the time to spread your expertise in this area. As I mentioned at the beginning of the show, this is not something that I really come across too much in my clinical practice, but when the show topic came out, it certainly garnered some interest. So obviously, the area of chronic fatigue is impactful to many, many people.
Sure. In fact, I didn't think I saw chronic fatigue in my office either, till I realized as we work with patients, people come in with different complaints. So,
and then you
the bigger challenge there is people came, they got their weight issues resolved, they got their pain better. However, what they actually would come and tell me is, I can't believe the amount of energy that I have at this time. And I don't take my afternoon naps. I feel like I'm more rested. I feel like I have energy all day. And even at 9 p.m., I seem to be wanting to keep going on. And that was really very enlightening to me. And I said, we never talked about fatigue. We never talked about the lack of energy. But they're coming and telling me about how phenomenal they feel with the changes that they made. And then I realized people actually struggle with fatigue and don't realize it because it has become something that's very normal to them. And I think that's where the challenge comes, is when you say you haven't seen fatigue, I don't think people really know that they have fatigue because they have learned to live compensating for this particular feeling, and it has become normalized in their life. Does that make sense?
It makes a lot of sense. It's a very interesting perspective on it, because one of my first questions out of the gate was going to be, is chronic fatigue a recognized medical condition in the medical world, or is this solely recognized within alternative health?
No, actually, chronic fatigue, if you go to CDC, there is a whole section on chronic fatigue syndrome, and also the brain fog associated with it. And for a long, long time, they've been saying we really don't know the reason why people have chronic fatigue. People wake up in the morning, and most of us feel energized soon after we wake up. I mean, at least for that moment, or maybe after your first cup of coffee. I don't know. People get energized at different points, but people with fatigue actually wake up feeling like they've run a marathon. They feel like there is no energy, and they have to have everything in them to squeeze things out to get to do their day-to-day work. That's one aspect. The other aspect could be they feel fine, but by the afternoon they just crash. It's almost like they need a pick-me-up. It may be a coffee. It may be a nap for a half hour, or they cannot function the rest of the evening. So there are different ways people present, but the one that's defined in traditional medicine is chronic fatigue syndrome /ME. That's it's a myalgic encephalopathy or an encephalgic condition, which means you actually have a lot of fatigue, pain, and brain fog. And for a long time, they said we don't know the reason, but we're beginning to realize the underlying cause of a lot of these conditions is inflammation, number one. Number two, could be the inflammation is coming from an underlying infection that we're not looking for, a persistent viral infection, a persistent fungal infection, which sometimes you're genetically wired not to get rid of. Or the way when I look at my patients is I categorize them under three main categories. One is chemical, the other is emotional, and the third is physical. So if you have a physical issue or an emotional issue or a chemical issue, and a chemical issue would be the infections, the chemicals we get exposed to that we're not able to necessarily detox off our system. Again, that's genetically wired, or mold ridden environment you might be working under. Maybe your workspace had a leak in the roof and they didn't fix it, and you don't realize that that's mold growing and you're actually reacting to it. These are the things that really really create inflammation, and the inflammation will translate into a chronic fatigue. So in the traditional world, there is no treatment. In fact, they don't even do the testing. They tell you that you have chronic fatigue, and they may treat the symptoms. But in functional medicine, which is a form of medicine, it's actually traditional medicine. It's just a different way of thinking and a different way of diagnosis. You look for the root cause. You ask the question why. You don't try to figure out what, but you try to get to the why. Do you have fatigue? Why are you struggling with it? And so you go dig deeper to find out what does the body need to heal, or what do you need to move out of your life, out of your way, so that you can actually find the energy once again.
It seems like there's a real spectrum of chronic fatigue because, in one instance you were talking about, in my envisioning and researching about the topic, the chronic fatigue where you just can't even get it going in the morning. It's just taking every ounce of effort. That to me would be more of the classical version of what I have read about chronic fatigue. And then the other spectrum is the crash, which I would almost say would be a blood sugar nutritional component. But you're saying there is quite a variance on how you would diagnose someone with chronic fatigue.
Absolutely. In fact, I think most patients don't complain. That is not their leading complaint, right? They come in for other reasons. It's usually chronic pain or insomnia. If only I could get to sleep, I would have more energy. Or it could be weight issues. I've tried everything under the sun and I'm just not able to lose weight. Or they also come in with depression and anxiety. And underlying to all of this is different degrees of energy resources that they can tap into. And one of the things I think we all need to get, everybody needs to understand this, your body works as a unit. So you don't have chronic fatigue as separate from everything else. So if you have chronic pain and you have fatigue, they're somehow connected. If you have diabetes, you have fatigue, they're somehow connected. If you have insomnia, you have fatigue, they are connected. These are not separate conditions that have to be listed on a medical chart so that you can bill for each condition. They are connected as a system. Your body is trying to get your attention. And this may be the time that you actually pay attention to it.
When someone comes in to see you and you suspect that they've got chronic fatigue, are there specific tests you do or blood markers that you're looking for? Or does this come into play with the diagnosis?
Sure. So from a medical standpoint, you can, if you go to a traditional medical doctor, they will run your thyroid. If your thyroid is fine, they'll say, or B12. More physicians are checking B12 and vitamin D levels. In a functional medical standpoint, what I look for is the whole metabolic panel. So I actually look for inflammation. There are specific blood markers. We call it the high-sensitive C-reactive protein. I look for fibrinogen, myeloperoxidase. And then we also look for cholesterol, in very high cholesterol in patients, homocysteine. So there are some markers that tell me there's a lot of chronic underlying inflammation going on. Then I look at a little more hormones than a traditional medical doctor would. So when I practice traditional medicine, I only checked for TSH. Now I look for the whole thyroid panel. I look at the adrenals. I also check your testosterone and we call the reproductive hormones. There could be a disruption in there, particularly something called DHEAS, which is, I would say, the parent hormone before you get testosterone or estrogen. So I look at the whole picture because, like I said, the body works as a unit. You cannot just shine your torch on just one aspect. You have to look at the whole body and see what's going on. And in functional medicine, the root cause of everything is the gut, so we definitely include the gut in our testing. So we do extensive stool testing to see, is there inflammation in the gut? Are there food sensitivities? Is there an infection that we are not identifying or it's not very apparent? And when we put all of this together, I call it the blueprint of the patient. I'm able to with a very high degree of accuracy and also a definitive diagnosis of, hey, this is actually feeding into your energy problems. And that's how we address it a little differently from a functional medical standpoint.
So the way you're explaining it, fatigue is more of a symptom of something underlying than an actual diagnosis in and of itself.
Actually, yes, that's how it should be. In fact, if you ask me, diabetes is a symptom of an underlying problem. Hypertension is a symptom of an underlying problem. We love naming things, and then we become those things, right? Mm-hmm. I'm a diabetic. I'm a hypertensive. No, you are not that. It is a symptom of an underlying problem. Let's work together and see where is the underlying problem.
So if I was to ask you this question, we're going to head to a break in a couple of minutes here, but I want you to give me a clear picture of what someone who is not suffering from fatigue is like. What should we look like under a normal, well-running system when it comes to our energy levels?
First of all, you would not be listening to this talk, right? Because health is not on your mind. You don't worry about your health. You just pretty much waking up in the morning, you're rearing to go. You don't need an alarm clock to wake up. You actually can continue the day without worrying about your energy resources. Look at a child. They know when to take a nap and they can go. It's like the energy, they just a ball of energy. And that's what you would do throughout the day. You are hungry when you're hungry. You don't overeat. You don't feel down after eating. You actually go to bed on time. You're not struggling to sleep. That's a clean machine that's running, which is almost impossible for most of us because our mind runs our bodies, right? So when you worry, you tend to have a little bit of fatigue here and there, but is it a chronic problem? And that's what we have to delve into. So yes, you will be a picture of health and you wouldn't be worrying about your health at all.
So the vast majority of us have some form of fatigue that we need to deal with because, right around 3-4 o'clock for me, it's like, okay, should I put my head down or I'm not sleeping the rest of the night? And that's more common than not.
Absolutely. But, on the other hand, you hear studies about power naps helping you get energized. I really think if we didn't have the electricity and all of the abundance that we have in life, we'd all go to bed by 5:36 when the sun sets because there wouldn't be light. And imagine if we didn't have fire, we didn't have candles, we would actually get to bed early. I think we're just running ourselves well past. We're really stressing the human body and mind in many ways. And fatigue is just, some people experience it more and others don't. But I will tell you, if you have purpose in life, you're less likely to feel fatigued.
Oh, so we're talking about a whole lot of psychosocial impact when it comes to chronic fatigue.
Sure, absolutely. There is no true physical problem I've ever seen in my life. All physical ailments have a mental component.
It's very interesting. I think this is a good time for take a break because when we come back, I want to deal with a whole bunch of other things and some questions that people have passed on to us. We'll be back in a couple of minutes, everybody.
At 20 years of age, I'm still looking for a dream. A war's already waged for my destiny. But you've already won the battle and you've got great plans for me. Though I can't always see, 'cause I got a couple dents in my fender, got a couple rips in my jeans. Try to fit the pieces together, but perfection is my enemy, and on my own I'm so clumsy. But on your shoulders I can see I'm free to be me. When I was just a girl, I thought I had it figured out. see my life would turn out right, and I'd make it here somehow. But things don't always come that easy, and sometimes I would down. Oh, 'cause I got a couple dents in my fender, got a couple rips in my jeans, try to fit the pieces together, but perfection is my enemy, and on my own I'm so clumsy, but on your shoulders I can see I'm free to be me, and you're free to be you. Sometimes I believe that I can do anything, yet other times I think I've got nothing good to bring. But you look at my heart and you tell me that I've got all you seek. Oh, and it's easy to believe, even though I got a couple dents in my fender, got a couple rips in my jeans, try to fit the pieces together, but perfection is my enemy, and on my own I'm so clumsy, but on your shoulders I can see I got a couple dents in my fender, got a couple rips in my jeans, try to fit the pieces together, but perfection is my enemy, and on my own I'm so clumsy, but on your shoulders I can see I'm free to be me, and you're free to be you.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, please call 416-245-1534. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back, everybody. We're talking with Dr. Nisha Chellam about chronic fatigue. Dr. Chellum, I love when I get a perspective from guests that I never thought of. And I was, just ruminating of this idea that a lot of people don't even know that they're chronically fatigued, that we've just learned to defend ourselves against this and deal with the symptoms. That's very interesting. And it leads into one of the most common questions that I was sent. How does someone know when they've crossed over from being just dog tired to having chronic fatigue?
Sure. So when you're tired, number one, you have a reason for it. You actually were running around, maybe doing your Christmas shopping, cooking and cleaning, and the next day you actually, and you go to bed, you wake up feeling completely refreshed. Instead of sleeping 7 hours, you actually slept all the way up to 10 or 12 hours, but you feel refreshed. That's not fatigue. But when you have not done anything, you just go regularly to work, your 8 hour, 9 hour, now hours including travel. You come back home, you don't have an ounce of energy to do just about anything. But you have kids at home, or you got to cook and you just don't have the ability to cook. You order out most of the days because all you can think of is putting your feet up and you just doze off watching TV. That is a degree of loss of energy, which can be fatigue. And when you wake up, you actually continue to feel tired. You could sleep a few more hours. I see this all the time, right? People wake up in the morning, they want to come for a doctor's appointment, and they would have just woken up, they've dressed up, they've had a shower, they sit in my waiting room and they go to sleep. And they just barely got in. It's not like I've made them wait for 15 minutes. It's like they just sit there and they're fast asleep. So those are the things that we look for, and those are the things people should look for. It's like if you don't have energy in the beginning of the day and there's no good reason for you not to have that energy because you've slept, you have a little bit of a problem that you need to address.
I think we can all sort of explain away being tired, though. It's a slippery slope when you're trying to explain away being tired and then, crossing this line and should I see a doctor? There's so many symptoms that I can pinpoint in, a lot of my days. But to get back to chronic fatigue here specifically, is sleep disrupted in chronic fatigue, or are you getting a powerful sleep?
You're actually wired to be tired, right? You're too wired. You're tired, but you're wired. So a lot of people with fatigue can barely sleep. They want to sleep. They actually would love to sleep, but they barely sleep. And a lot of times when they sleep, it's not a deep sleep. They'll say, I just shut my eyes. I wasn't sleeping. But they were actually sleeping to the rest of the folks watching them. I mean, you slept really well. And so that's where family begins to think, oh, you're just lazy. Because you're sleeping so much and yet you complain of feeling tired. And that's one of this, particularly I see it with thyroid. When your thyroid is dysfunctional, family members will actually say, oh, she's very lazy. But actually they're not lazy. They just don't have, the energy is not there. And no matter how much rest they get, first of all, their body directs them to rest. And no matter what rest, in terms of depth of sleep or how much sleep or how many hours they've been laying in bed, they still wake up feeling tired. So it's very difficult. I would say the way, am I tired, am I fatigued, to differentiate between the two, if this is very often an excuse that you give to people, or I am too tired, you may have to actually look at it as a symptom of something that's underlying.
Now, is the thyroid your first area of concentration?
So when women come to me, I do look at the thyroid because we're beginning to see more and more disruption of the thyroid. But as I delve into this, now I've practiced now for 22 years, and I find the biggest, I would say the most common reason why thyroid gets disrupted is underlying stress. They've had an event in their life. It could be a failed relationship or moving away from home, something very emotionally triggering. And the other most common cause in women is pregnancy, the very first child. The birth of the first child, something changes completely. Physiologically, it's a stress to be pregnant. As much as we all love being pregnant and have babies, it actually is a huge stress for the body. And a good percentage of women come out with an inflammation of their thyroid. And they have this persisting fatigue, which they chalk up, like you said, to, oh, I didn't sleep last night, the baby didn't sleep well. Or, I just have a newborn at home. And that fatigue continues on for a year. It's in the second year they come to me and say, I thought it was because of my baby, but now my baby's sleeping through the night. I just don't understand why I don't have the energy. And that's when I go for the thyroid, because it's very classic soon after a pregnancy or soon after a major emotional event. Your thyroid, for some reason, fails.
So you don't know that reason why the thyroid. I was just going to ask you, why is a thyroid impacted by stress?
Yeah, that's a very interesting question, and we only have theories about it. What happens is when you have stress, your cortisol goes up, and people have cortisol is that hormone that's produced by a gland called the adrenals, which is sitting on top of your kidney, and that's the one. It has two different hormones it produces, like when you are shocked about something or when you have an acute stress, like you were just trying to avoid a car accident. Your heart rate goes up, your pupils dilate, you become defensive. That's the adrenals or the adrenaline. And when that hormone, it's acute and it goes away. But when you have chronic stress, where you're constantly stressed, either by finances or by a relationship or by just life in general, then the body switches over to producing what is called cortisol. We think this cortisol destroys the gut lining. And the gut lining is the place where you have your immune system. The immune system then gets haywire and really tends to attack the thyroid, mostly in women. And maybe there's a genetic wiring. So a lot of times stress of any kind, physical, emotional, chemical, can translate to an attack on the thyroid because of what is happening in the gut.
The adrenals run the show.
The adrenals a lot of times run the show if you're chronically stressed, yes.
So then it begs the question, do women, in your practice, in research, do women suffer more from chronic fatigue than men?
Yes, they do. Thyroid, fatigue, chronic fatigue, these are all things that women tend to have. I think it's almost, if you lined up 10 people, 8 of them would be women.
Interesting. And if you're having child, for instance, myself, I had 3 children 2 years apart. I mean, you're learning to deal with this fatigue very well. And that does feed right back to what you were saying, that a lot of people have built up walls to deal with this chronic fatigue. Now, we don't want a rush of people coming into the doctor's office claiming chronic fatigue. That's not what we're trying to do here, correct?
No, not at all. It's just, if you know, one of the things I tell people is every symptom is important. A lump in the breast will alarm everybody. A chest pain will alarm everybody. But why is that when you get up and you were normally energetic and now you're not, you're giving yourself excuses. When you get up, you have knee pain and you normally don't. You're giving excuses as to why, my mother had arthritis, so I have arthritis. I mean, we just kind of brush aside these symptoms, which allow us to compensate in a different way or do not prevent us from doing our daily tasks, right? Mm-hmm. It's either fear-based or if it hinders your daily tasks, that's when you pay attention to it. Hypertension, nobody cares about hypertension because the doctor cares about it. Oh, your blood pressure is high, here, take a pill. Half the time you forget to take your medicine because you don't know what it's doing for you, because it's not necessarily a symptom that is bothering you. So that's why it becomes important that you don't accept simple symptoms or change in your well-being, no matter how minuscule the change might be. Pay attention. Ask questions. Why am I feeling this? And actually give a better answer than, I'm just running around. You're all the time running around. If you're the kind that runs around once, you're all the time. How you do one thing is how you do everything. So fatigue might be a new symptom for you, or feeling tired easily may be a new symptom for you, or pain might be a new symptom for you. Pay attention, ask questions. But you have to also go to the right doctor, by the way.
Well, this is the thing, right? So you were a typical MD, is that correct?
Yes.
So what just finally pushed you over to functional medicine?
Yeah, that's a very good question. So I come from a family of 9 of my aunts and uncles were diabetics, and 4 of them died from complications of diabetes. So when I was 42, I remember feeling this fatigue, especially the 2 o'clock crash. I would drink 5 cups of coffee. I started losing my hair. I was gaining weight. I had knee pain. I had back and neck pain, which I couldn't explain, but my mother had arthritis. And then I also started having high blood sugars. Like my sugars would go, I would have a crash, I would have high sugars. Otherwise, I could not sleep, which was never an issue for me. I could sleep anywhere and I would wake up. So when I checked my blood sugars, it was high. I had the 90-day average is called A1C, hemoglobin A1C. I was at 6. So I was a pre-diabetic. And I started myself on metformin because I was traditional MD, and I studied everywhere that metformin really helps with insulin resistance. Mm-hmm. And I accepted it till I found that my migraine headaches, which I used to get once a month, were happening every day. So you see the pain that pushed me. So now I couldn't show up at work on time because in the morning I had to chug down 2 Tylenols, sleep an extra hour to get the pain go away so I could function the rest of the day. When that pain became severe and I went to a traditional endocrinologist, I didn't want to treat myself. She said, come back in 6 months. We'll see if something shows up in your blood work. And somebody introduced me to a functional medical conference. And it changed my world because I realized we're accepting certain things as it's genetic, or this is something that runs in your family, therefore you're going to get it. I was in my 40s, headed towards becoming a full-fledged diabetic, but my aunts and uncles were in their 60s when they first got diagnosed with diabetes, or they had any medical issues. And I'm thinking, why am I 2 decades earlier when I asked those questions, when I went to functional medicine and I realized you got to look at things differently. You have to look at, why is this person having it? What do they need in order to heal, or what do they need to remove, is when my thought process shifted. So I started doing better blood tests. I started asking better questions. And I realized the only way to help a patient is a patient has to run the care. In fact, they are leading the care, right? I, as a doctor, know much more about the disease than you do, but you, as the patient, know much more about you than I do. And that's where 10 diabetics cannot be treated the same way. Every diabetic has an internal and external stressor that's unique to them, and we've got to address that very differently. And that's why the traditional medical world, I realize I've been giving the medicines that they tell me to give to patients. I've been treating my diabetics, my blood pressure patients, my cholesterol patients, but their disease don't go away. If they stop taking the medicine, it all comes back up again. So what are we treating? We're managing disease. Can we actually resolve it? That's the question you have to ask. And what I realized is my migraines went away. I'm never going to be a diabetic. I can tell that confidently. I don't have any aches and pains. I was able to get back to my weight. My hair it stopped falling, in fact, started growing, because I suddenly realized what my body needed and what kind of a lifestyle I needed to live in order to keep health a priority. Because if you have health, you have everything. Right? Mm-hmm. If you have clarity of thought, you have strength, you have energy, you can achieve just about anything you want to. And that's something that was really the shift. And I realized I was not going to be able to practice medicine the traditional way. And that's how I shifted to practicing 100% functional medicine.
It just makes so much sense, but we're still caught in the crosshairs of this because there are not a lot of functional medicine doctors available to us, and symptomology is often just treated. I know someone caught in the crosshairs right now. High blood sugar, never been an issue before, but has had has had some severe inflammation issues. And there's no line connecting severe inflammation and diabetes, but I'm sure you've seen this happen.
Absolutely. People all the time come in, right? They say, oh, I have multiple medical issues. No, you have one medical issue that's causing multiple symptoms.
Right.
So, and that's the shift that doctors need to make. That's the shift patients need to make. You're not. There's nothing that really it makes me feel sad when a patient comes to me defeated saying, oh, I'm a diabetic. I've been a diabetic for 25 years. Could you just renew my medicines? Mm-hmm. And it's like they don't even ask the question, is it feasible for me to get rid of my diabetes so everybody in my family is a diabetic? They don't just ask that question. They've not even been taught to ask beyond what they've been told.
And that's the key there. They're not being taught to ask, because honestly, someone who's got, severe suffering from severe symptoms, they're given a medication, those symptoms go away and they're happier. And that's where the story ends. Yes,
absolutely. I totally agree. I take responsibility as the medical, as a physician and the medical system I came from, the education I came from, is remember the word patient means sufferer, right? We're putting an end to the suffering. So anything that we can do to reduce the suffering of our patient healing. But we have to define it, we have to completely have set different expectations for ourselves and for our patients. You have to actually truly resolve, not just manage. If you're happy taking, 10 pills in the morning, that's fine. I mean, that's the choice you're making. But if you want to ask better questions, ask, why do I have this? Is there really a genetic component to this? I mean, I think there is we're all genetically at a risk for certain diseases, but can your environment prevent you from having these diseases? So what in my environment should I change so that I can stay healthy? So just ask different questions. Be a partner in your care, not a passive consumer, which is what patients have become, unfortunately, and that's what the medical system teaches them.
Well, Dr. Chellum, I think, we've gone far past dealing with chronic fatigue, and you've sort of summarized everything that this show is trying to do, and that is equip people with knowledge to ask questions. And it's still we still have this notion that the doctor is the be all and the end all, and I'm not taking away from doctors at all. But what I want to do, and what you are doing, and people of your ilk are doing, are equipping patients with at least ask why.
Yeah.
And I think that is vitally important, and the message that we at the Health Hub so want to get out to everybody, and especially when you must see this a lot of times, someone who has been ill, someone who has had an autoimmune flare-up, and symptoms of high blood sugar correlate, or symptoms of chronic fatigue. Connecting those dots, you go to get the traditional test done, and you've got high blood sugar, and then, we've got to just deal with the high blood sugar. But it makes a lot of sense to make these connections with other issues that have been going on. Is that right?
Absolutely. And I tell the patient, the doctor knows your disease, but you need to know why you are struggling. A lot of times, patients don't want to think of why they're struggling. You'll be amazed at how many times they'll tell me, you know what, you're right, it's the job that's killing me, or it's the relationship that's killing me. They just don't trust themselves, and they feel like all my solutions are going to come from the outside, but your solutions are within you. If you look at my tagline, I always say, the best place in my office is a place where you'll find your best doctor, which is you. Because you know what you got to do. You just too scared to do what you ought to do in order to get better.
Well, we're looking, one of my greatest pet peeves, and a fear of mine, because I've had a lot of testing done because I have had cancer. I hate testing. And I think the reason why I hate getting tests is because the results seem like a finality sometimes, as opposed to an indication. And I think if we can change the mindset of testing as an inclination towards getting down the right path, more than you've got this, we have to treat it, which to me invokes fear.
Absolutely.
And I would really love to hear your opinion on that notion.
Sure. So the way I look at testing is looking at the score board for a game, right? You're playing the game of life. Now, I don't think you want to play, you could not play a game successfully if you don't know what you're scoring. Imagine having a blank scoreboard and you're just throwing baskets or hitting balls, but you don't know how much you're scoring. It doesn't give you anything. A lot of people tell me that I don't want to do my test. I don't want to find out what I got. What I tell people is the reason you feel that way is because you've been told once you have this, it's the end of the world. What I want people to understand is testing actually picks up stuff that you can prevent. True prevention comes from the correct testing. For instance, yesterday I had somebody who's been struggling to lose weight see me, and they've been eating what is called the ketogenic diet. And their genetic wiring shows that they don't process fats well. If they ate a high-fat diet, they will continue to struggle with weight issues. Now, that was an eye-opener for her. And that's what testing should do. Testing should give you information that you can use, monitor, and shift how you live your life. That's what testing should do. It's not a statement. It's not something. It's not a death sentence.
Exactly.
It's actually something that gives you information. It's like balancing your accounts. You look at it and you say, oh, so today I cannot spend here, or I have a surplus for this. That's what testing should be looked at. It's never a statement. It's never a diagnosis. It's just, this is what needs a little more attention. Let's figure out why it's abnormal.
It gives you actionable steps, and I think that's brilliant. I'm so glad that we got down this road of conversation because it's hard to have a show on the validity of testing and so forth. But just from personal experience, I really do have a hard time being lined up for a bunch of tests. But I do, and it is a thing. But to have the right framework and paradigm of how to approach these tests, I think is so important. It's been a wonderful, wonderful conversation, Dr. Chellum. Thank you so much for joining us.
And thank you so much for this opportunity. I hope everybody got something out of it.
Oh, I'm sure they did. And everybody, we will talk to you next week on The Health Hub.
You have been listening to The Health Hub